Hello everyone, I am Dr. Roy Solanki. Today we are going to discuss one very complicated or one very confusing topic, that when we have to prefer MRI and when we have to prefer the CT scan. This is a normal question every newcomer in the Department of Radiodiagnosis or our colleague friends, physicians usually used to ask us that in this condition what we have to prefer, MRI or CT scan. So choosing the right lens for the every diagnosis. Here we are with the dealing with this confusion. So we have some advantages of MRI here and some disadvantages of MRI. Advantages of MRI is there is no radiation exposure, there is a good resolution, better 3D construction, good gray and white matter differentiation, adjust setting based on characteristic of the lesion, and a gadolinium contrast is relatively non-toxic. However, if we do the multiple scans, then this gadolinium could get deposited in our body, but for a few scans it is better for our body. So here every coin has the two sides. Some we have some disadvantages of MRI. First one is the cost. It is very costly, and second one is the patient is invisible because the pacemaker or metals, because it has the magnet inside it. So the patient who is post-op cases with the implants, metals in their body, they are not eligible for the MRI. Claustrophobia is one of the major problem because it takes a long time and machine has the multiple lengthy noise procedure, and also it's a limited availability. So these are some advantages and disadvantages of MRI. Here we have the alternative option, CT scan. It is a but obviously quick and painless and takes a short duration of time, better availability than the MRI. So of the acute bleed. So in the case of the we have the shortage of the time, so we will prefer the CT scan. Good resolution of bony structures and calcification, and exclude the presence of more serious problems. So if in case of the screening or in case of the emergency or this patient end up in our emergency department, we are not in the uh, dilemma of the diagnosis, so we should prefer the CT scan. But here also some disadvantage of CT scan. The one major disadvantage is ionizing radiation. So we cannot advise the pregnant or lactating females or the condition repetitive scan related to the cancerous condition. It has a poor resolution as compared to the MRI, but it still it depends on the how many slice CT scan you have. Beam hardening artifact. One major problem is the contrast. So it's a contrast from the CT scan is injurious to our kidney and our body. It could lead to the anaphylactic reaction, and some procedure requires the anesthesia. It deals with both MRI and CT scan. So what is the general guideline to follow when to prefer MRI or when to prefer the CT scan? Here, some soft tissue, cartilage, ligament, and nerve related pathology. For this, we have to prefer the MRI. But for the acute trauma, where we have the shortage of the time, bone fractures. So, bone fractures better till we are visible on the CT scan. In emergency required rapid evaluation, we have to prefer the CT scan. But this is not so simple. Here, we have the problem of the neurological condition. First one is stroke. So if the patient is in the condition of the ischemic changes, early ischemic changes, we can prefer the diffusion weighted imaging or the brain stem. In fact, we can prefer the MRI. But for the initial evaluation for the hemorrhagic stroke, we have to prefer the CT scan because it takes some short time, so patient go for the treatment. In case of the brain tumor, as it has a soft tissue, so superior soft tissue contrast and tumor characteristics will be better appreciated on the MRI. While in the case of CT scan and calcification, or if we want quick evaluation of the tumor, then we have to prefer the CT scan. In the multiple sclerosis, our CT scan do not have any significant role, while our MRI used to help in the detection of the plaques on treatment flare imaging. Head trauma. In head trauma, we do not prefer the MRI because it's not good for it. So we take a long time. But in case of the soft tissue involvement, we can prefer the MRI. In the head trauma, we usually want to look for the acute hemorrhage or any fracture, so we will prefer the CT scan. In the epilepsy, our CT scan has no role, while our focal cortical dysplasia and the mesial temporal sclerosis will be better demonstrated on MRI. In the hydrocephalus condition, there will be the gross dilatation or the dilatation of the ventricular system, which leads to the symptoms of patient. So in emergency department, patient end up with the symptoms of the hydrocephalus and we want the emergency diagnosis of it, then we will prefer the CT scan. While for the ventricular system assessment, we have to prefer the MRI. For any infection of the brain, we should prefer the MRI, but in emergency abscess detection, we should prefer the CT scan. So, CT scan has no role in the multiple sclerosis or epilepsy protocol. It has a limited role in the acute condition like the acute hemorrhage and fracture and emergency conditions like the abscess or hydrocephalus. So, this is next over is the spinal conditions. In spinal conditions, CT has a limited role in detecting early the fracture of the spinal cord or a rapid diagnosis. Rest MRI has a role in the disc herniation for the detection of the nerve root compression and soft tissue involvement. In spinal trauma, for the vertebral fracture per se, we used to prefer the CT scan, while for the ligament injury or the spinal cord assessment, we have to prefer MRI. For the spinal tumor, there is no role of the CT scan as such. The soft tissue lesion and evaluation of the spinal cord or spinal tumor will be better on the MRI. Here we have the MSK or the musculoskeletal system. In MSK, again the joint injury like ACL, PCL injury suspicious after the sports injury or the twisting injury, we will advise the patient to go for the ligament, cartilage or soft tissue MRI, while a CT scan in this cases will be limited role in the bone involvement or any fracture. Bone tumor, the soft tissue extension will be better appreciated on MRI, while initial bone lesion assessment will be better on the CT scan. Stress fracture, for the rapid assessment we will go with the CT scan again, but for the early detection and the soft tissue involvement we will use the MRI. Osteomyelitis, it's an infection of the bone marrow of the bone, so soft tissues and the bone marrow changes will be better appreciated on MRI. It's a gold standard for diagnosis, while for the bone destruction and periosteal reactions we will prefer the CT scan. Next one is our chest condition. In chest condition is cardiac imaging. For the cardiac imaging, for the viability of the cardiac tissues, for the perfusion of the cardiac tissue, we will prefer the MRI. But for the coronary artery calcification detection, CT scan is better modality. Pulmonary embolism, the MRI has a rarely used or has no significant role, while gold standard is a CT pulmonary angio for the pulmonary embolism. For the lung lesion, because of the artifacts and all, the MRI has a limited role, while the CT for the nodule or characterization of the lung cancer, or we prefer the HRCT chest. Abdominal conditions like the liver lesions like hemangioma, focal nodular hyperplasia, they will be detected better on the MRI, but acute liver trauma or calcification, we can prefer CT scan. For pancreatic lesion, if you want detailing of the soft tissue, then we have to prefer the MRI, while for the calcification or the acute pancreatitis like condition, we can prefer the CT scan. For renal lesion like cyst or tumor differentiation like this dealing of the condition, we will prefer the MRI, but for the stone detection, we will prefer the CT scan. For abdominal trauma, again MRI has a little role, rarely used, but for solid organ injury, we have to prefer the CT scan. So here the some pelvic condition for the uterine or ovarian abnormalities, MRI used only in the fibroid or adenomyosis ovarian cyst, but CT scan has limited role in the uterine and the ovarian abnormalities. Prostate evaluation, we used uh, multiple parametric MRI. Cancer staging, we use the MRI, while CT scan has no significant role in the prostate evaluation. For bladder masses, rarely used MRI, but we use CT scan for the initial evaluation. So after knowing all these facts and when to prefer MRI and when to prefer the CT scan, hopefully this video is very helpful to all of you. So thank you so much, myself Dr. Rohit Solanki. Kindly like and subscribe.